Principal Investigator, Esther Kim. Enhancing Neuroplasticity in Aphasia, a pilot study examining non-invasive brain stimulation and treatment intensity. Aphasia is a neurological disorder caused by damage to the portions of the brain that are responsible for language. Nearly 1/3 of the 50,000 Canadians who suffer a stroke each year will have their communication abilities impacted, leaving them vulnerable to social, occupational, and quality of life decline. The number of people affected will continue to rise with an aging population. With the continuous strain on healthcare resources, there is an urgent need for effective therapies that can maximize the recovery of language abilities. This pilot study will look at innovative ways, such as non-invasive brain stimulation, to improve speech-language therapy outcomes for people affected by aphasia. Principal Investigator, Lonnie Zwagenbaum. Development of the Autism Social Participation Classification System, ASPCS, for preschool children with autism spectrum disorder. Autism spectrum disorder affects roughly 1 in 68 children who are at high risk for not participating in social activities like play. Currently, assessments measure the symptoms of autism spectrum disorder but do not describe where the child's abilities fit along the spectrum. This study will look at developing a new assessment tool, the Autism Social Participation Classification System, to assist communication between families, professionals, and educators in tracking meaningful, strength-based descriptions that correspond to levels of individual abilities of preschool children with autism spectrum disorder. Principal Investigator, Trish Manns. The feasibility of a home-based transition intervention to reduce sedentary behavior and improve function within the first 6 months after stroke. At the Glenrose, patients with stroke are seen by a variety of healthcare professionals, either as inpatients, outpatients, or both. As inpatients, they receive intense therapy, at least 3 hours per day during their stay. After their discharge, the intensity of therapy and general activity decreases substantially, causing concern that gains made while at the Glenrose Rehabilitation Hospital are lost. This study will look at the feasibility of a new activity-based intervention being delivered in the community to guide further research about the health impacts of a reduction in sedentary behavior and an increase in light-intensity physical activity in people post-stroke. Principal Investigator, Doug Hill. A new spinal orthosis design concept for the treatment of adolescent idiopathic scoliosis, AIS. Scoliosis is a curvature of the spine that is most commonly corrected in adolescents using a spinal brace that is a hard plastic shell with pressure pads installed in a liner. It is physically restrictive and uncomfortable, and patients often need to commit to wearing it continuously for a year or more. Orthotists have been challenged to design a brace that provides the best correction within the patient's level of tolerance. This study builds on the idea of using ultrasound and a Microsoft Kinect camera system to capture brace-fitting images to build a better spinal brace for the treatment of scoliosis. This would result in healthcare savings, reducing a patient's exposure to radiation, and building a more effective and comfortable model for the patient. Principal Investigator, Dr. Florencia Ricci. Understanding the child with major neuromotor disability following early complex cardiac surgery. The survival rates of neonate after a complex cardiac surgery have increased by 85%. Many of these children face neurodevelopmental and neuromotor challenges. Permanent motor impairments can include cerebral palsy and acquired brain injury, including stroke. This study will look at the frequency of these disabilities in children after early complex cardiac surgery to assist healthcare providers in applying greater effort in their reduction. This study will potentially impact practice by not only changing the frequency of these adverse developmental outcomes, but also in predicting the numbers of patients we can expect to see and types of services anticipated in planning of service delivery models in the future. Principal Investigator, Dr. Ming Chan. A novel electrodiagnostic method to quantify the severity of diabetic polyneuropathy. Diabetes affects approximately 3% of the general population, and its prevalence is on the rise. Diabetic polyneuropathy is common among elderly patients at the Glenrose and is a type of nerve damage that leads to numbness, loss of sensation, pain in the feet, hands, and legs, which can be very debilitating. A non-invasive, reliable method of tracking its progression is needed to manage patients with this condition. This study will look at using a non-invasive electrodiagnostic method of examining sensory nerve fibers that can complement existing sensory testing and skin biopsy for a comprehensive assessment. Principal Investigator Kim Adams. Building an effective mentoring program for adolescents and young adults who use augmentative and alternative communication. Adolescents and young adults who use augmentative and alternative communication face barriers in maximizing their education, vocational outcomes, becoming active participants in society, and realizing a high quality of life. Mentoring will be used to partner more experienced people with less experienced protégés to help with many activities of daily life. This study will look at evaluating the effectiveness of an online mentorship course by assessing a participant's socio-relational and problem-solving skills before and after the study.